In this video, I will discuss hypersensitivity, all about hypersensitivity, that is, its types, their mechanism, pathogenesis and their examples. So let's start hypersensitivity. For understanding hypersensitivity, it's important to understand the immune response. What is immunity? Whenever any foreign material or any foreign thing enters in human body, the immune response gets activated and it gives protection and defense mechanism against the foreign material. So immunity is protective and defensive in nature. That's why immunity is good for human beings, right? But sometimes immune response becomes excessive. It becomes exaggerated. And apart from harming or damaging the foreign material, because it is exaggerated and because it is excessive, it harms the host tissue also. That is known as hypersensitivity. So immune response is protective, but sometimes it may be injurious to the host cell also. That is known as hypersensitivity. So hypersensitivity is a condition in which the immune response results in excessive reaction, leading to tissue damage, diseases, or sometimes even death in the sensitized individual. That is known as hypersensitivity. So we can define hypersensitivity as it is the exaggerated state of normal immune response. It is the exaggerated state of normal immune response which results in adverse effects on the host body. So that is hypersensitivity. Now coming on types of hypersensitivity. Hypersensitivity is of two types, immediate and delayed. Based on the onset and duration of action, hypersensitivity is defined and it is classified into two types, immediate and delayed. So immediate and delayed, you can see the differences between them. Immediate and delayed type of hypersensitivity. In immediate type, the onset is very fast. So it appears fast and recedes rapidly. So onset is fast and duration is short. Onset and duration both are less. But in delayed type, they appear slowly. This type of hypersensitivity appears slowly, maybe 24 to 72 hours after the appearance of the antigen, and it lasts longer. So onset is slow and duration of action is also longer. So in immediate type, the onset and duration both are less. In delayed type, the onset and duration both are prolonged. Coming on the immune response, you can see immediate type is antibody mediated. That's why it's fast. And delayed type is cell mediated, that is T lymphocyte mediated. That's why it is slow. Now about the passive transfer. Passive transfer is possible in immediate type because in passive transfer, antibodies are transferred in the serum. So passive transfer is possible with serum in immediate type because it is antibody mediated. But passive transfer cannot be done. The hypersensitivity cannot be transferred with passive transfer, the delayed type. But delayed type, it is possible with the lymphocyte transfer or transfer factor. Now desensitization. Desensitization is easy in immediate type but it is short-lived. And desensitization is difficult in delayed type but it is long-lived. Now coming on the induction. Induction of the immediate type is by antigens or haptons or by any route. But in delayed type, induction is by antigen if injected intradermally only, not by any route. So these are the differences between immediate type and delayed type, the two types of hypersensitivity. Now coming on the one more, second type of classification of hypersensitivity, which is given by Coombe and Gell. That's why it is known as Coombe and Gell classification. According to Coombe and Gell classification, the hypersensitivity are of four types. Type 1, Type 2, Type 3 and Type 4. Type 1 is known as anaphylactic. Type 2 is known as cytotoxic. Type 3 is known as immune complex. And Type 4 is known as delayed or cell mediated. These are the four types of hypersensitivity. Out of the four types, the first three types are immediate and the last one delayed. So out of the four types, these three types fall under the category immediate hypersensitivity and the last one is the delayed one. So you can see type 1, it is known as immediate anaphylactic and it is IgE antibody mediated. Type 2 is cytotoxic, it is IgG antibody mediated. Type 3 is immune complex mediated, it is also IgG antibody mediated. That's why first three types, type 1, type 2, type 3, they all are antibody mediated. Although type 1 is IgE antibody mediated and 2 and 3 are IgG antibody mediated, but they all are antibody mediated. That's why they are immediate. But the last one, type 4, delayed type of hypersensitivity, it is cell mediated. Here antibodies have no role. B lymphocytes, plasma cells have no role. It is the delayed type. Now, I will be discussing the pathogenesis of all four one by one along with the examples in detail. Let me start type 1 hypersensitivity. So, type 1 hypersensitivity is known as anaphylactic or atopic reaction. Basically, type 1 hypersensitivity are allergies. So all the allergies fall under this category, that is type 1 hypersensitivity. Here, it is a rapidly developing immunological response which occurs within minutes after combination of the antigen and antibody bound to the mast cells in the individuals who are previously sensitized. And this is referred as allergy. And it can be anaphylactic if it is systemic, and it can be atopic if it is localized. So anaphylactic and atopic are the two types of the allergy. That is type 1 hypersensitivity. Now in this flow chart, you can see the complete mechanism, the pathogenesis of type 1 hypersensitivity. So as soon as the allergen, this is the allergen, entering human body, the complete mechanism is shown. So let me explain you the mechanism here, then I will draw the mechanism for you. So here you can see the allergen. The allergen can be anything. It can be pollen grain, it can be dust particle present in the air, it can be some pollutant present in the air, it can be anything. So whenever the allergen, for the sensitized individual, whenever the allergen is entering in human body, the first cell with which it comes in contact is the dendritic cell. Dendritic cells are the antigen presenting cells. So they engulf the antigen. You can see the antigen is engulfed by them, dendritic cell. So after engulfing, they process the antigen, they degrade the antigen and present the antigen on the surface to the next cell. The next cell are naive T cell or Th2 helper cells. Th2 helper cells, they get stimulated. So on receiving the signal from the dendritic cell, when the dendritic cell presents the antigen on their surface after degradation and processing to the Th2 cell, they get activated and they secrete cytokines. Three types of cytokines are secreted from Th2 cells: IL-3, IL-4, IL-5, interleukin 3, 4, 5. So interleukin 4 go to the B cell. The next cell in the row are B cell, B lymphocyte. Interleukin 4 stimulates B cell and convert B cell to plasma cell. You can see B cell converted to plasma cell. Now plasma cell form antibodies. There are 5 types of antibodies: gamma, IgG, IgA, IgM, IgD and IgE. So here plasma cells in type 1 hypersensitivity always form IgE. So you can see IgE type of antibodies are formed. You can appreciate these are the antibodies. These are Y-shaped antibodies which are formed by the plasma cells, and these are IgE type of antibodies. Now these antibodies are released in the blood. In the blood they will go on the mast cell. You can see the next cell is the mast cell, and on the surface of the mast cell the antibody will bind with Fc fragment. Fab fragment is free, but via Fc fragment, that is constant fragment, the antibody is binding on the surface of mast cell. Now this is known as sensitization. The individual is sensitized now. Now when the same antigen enters human body second time or subsequent time, so this antigen will directly go to the antibody which is already formed by the previous immune response. So antigen will directly go to the antibody, bind with the surface of the antibody which is already present on the mast cell. So here you can see antigen is binding on the surface of the antibody which is already present on the surface of the mast cell. So whenever antigen binds with the antibody, antibody will give signal to the mast cell that antigen have arrived. On receiving the signal, mast cell will burst. Mast cell will burst and the granules inside the mast cell will come out. This is known as degranulation of mast cell. And the granules of the mast cell contain various chemotactic substances that will bring the symptoms of the allergy, that is anaphylaxis or atopy. So let me discuss the complete phenomenon in detail, the pathogenesis in detail. So as I have told you, during the first contact, whenever the antigen, the allergen enters the human body for the first time inside the host body. So during the first contact of the host with the antigen, this is known as sensitizing dose or priming dose. So antigen is captured by the first cell. The first cell is the antigen presenting cell or dendritic cell. Now after capturing or engulfing the antigen presenting cell, degrade the antigen and process the antigen and present it on the surface. So it is presented to the Th2 cell. Th2 cell secretes cytokines, that is interleukin 3, 4, 5, out of which interleukin 4 activate B cell. So first of all antigen presenting cells are coming. They are going to Th2 cell and Th2 cell secreting cytokine and cytokine is stimulating B cell. On activating, B cell will get convert to plasma cell. You can see the activated B cell, they will convert to plasma cell. Plasma cells start forming IgE antibodies. These IgE antibodies will go in the blood. In the blood, they will bind on the surface of the mast cell with the help of Fc fragments. So you can see the complete story as I have told you. You can see this is the antigen. As it is coming captured by that dendritic cell or antigen presenting cell, it is going to helper Th2 cell. It is secreting cytokines. It is activating B cell converting to plasma cell, and plasma cell secreting Ig antibodies. It is released in the blood and it is binding on the surface of the mast cell. Now, it is known as sensitization. The first event, sensitization, is over. Now, mast cells are fully sensitized for the next event. Now, during the second contact or subsequent contact of the same antigen in the same host body, in which sensitization is already done. So, during the second contact with the same antigen, this is known as shocking dose. Now, the Ig antibodies which are already formed and they are present on the surface of the mast cell, they get activated. So, when antigen bind with the antibody, they will get activated. Antibody will give signal to the mast cell will burst. So, membrane of the mast cell will lysis and the granules inside the mast cell will come out. This is known as degranulation of mast cell. So, you can see during the second contact, the same antigen directly go to the antibody which are present on the surface of the mast cell and which causes degranulation of the mast cell. You can appreciate the granules coming out. So, let me draw the complete mechanism for you in short. So, this is the antigen. This is antigen entering first time in human body. So, the first cell which come in contact is the dendritic cell. This dendritic cell is also known as antigen presenting cell, APC. Now, the antigen is captured by this cell, that is antigen presenting cell or dendritic cell. It will degrade the antigen in the cytoplasm into multiple pieces, process the antigen and then present the antigen on the surface with the help of MHC molecule. It will present to the next cell. The next cell in the row is Th2, helper T cells, Th2 cells. They will get stimulated. On stimulating, they will secrete cytokines from it. That is IL-3, IL-4 and IL-5, interleukin 3, 4, 5. Out of which interleukin 4 will go to the next cell. The next cell in the row is the B cell, B lymphocyte. On receiving the signal from interleukin 4, it will get stimulated and B cell convert into plasma cell. So, next cells are plasma cell. They will convert into plasma cell. Plasma cell will start forming antibodies. So, the antibodies which are formed are IgE antibodies. So, there are 5 type of antibodies, gamma, IgG, IgA, IgM, IgT, Ig. Here, IgE type of antibodies are formed. These IgE type of antibodies will released in the blood and they will bind on the surface of the mast cell. So, this is mast cell. On the surface of the mast cell, these IgE antibodies bind with the help of Fc fragment. This is known as sensitization. So, with the help of Fc fragment, it is binding. This is known as sensitization. When the same antigen enters human body again, second time or subsequent time, now this antigen will directly go to the antibodies present on the surface of mast cell. It will bind with the antibodies present on the surface of the mast cell. So, antibodies will get stimulated. They will give signal to the mast cell. On receiving the signal, the mast cell will burst. When the mast cell will burst, the granules inside the mast cell, they will released out. This is known as degranulation of mast cell. Now, the granules of mast cell contain 7 important chemotactic materials. It contains histamine, it contains serotonin, it contains leukotriene and prostaglandin, it contains platelet activating factor, it contains chemotactic factor, and it contains, these are the important chemotactic materials which are present in the granules of the mast cell, and they all will cause the various phenomena in human body which are the symptoms of allergy. So, this is the complete pathogenesis. Here also in this diagram, you can see this is a mast cell. You can see it is sensitized by IgE antibody. So, on the surface of the mast cell, IgE antibody is present. Now, you can see whenever antigen is coming, the antigen is binding with the antibody which is already present on the surface of the mast cell. So, you can appreciate the mast cell degranulation takes place. The granules are coming out. These are the chemical mediators. Now, these chemical mediators, enumerate them. The granules contain 7 material. It contains histamine, serotonin, vasoactive intestinal peptide known as VIP. It contains leukotrienes, B4 and D4 especially. It contains prostaglandins, especially thromboxane A2, prostaglandin D2 and E2. It contains platelet activating factor and it contains chemotactic factor of anaphylaxis for neutrophil and eosinophil. These all are present in the granules of the mast cell. So, these all are secreted in the blood. During degranulation of the mast cell, when the mast cell is bursting, these all are secreted out. So, you can see all these cytokines, all these mediators are secreted out, and once released in blood, these mediators will cause what? They will increase the vascular permeability leading to edema in the body. They will cause smooth muscle contraction. So, they can cause various symptoms due to this smooth muscle contraction. They early vasoconstriction followed by vasodilatation. So, initially vasoconstriction is there, which is followed by, so initially BP will rise and after that BP will fall. So, due to fall of BP, patient can go in shock. After that, they can cause increased gastric secretion. increase nasal secretion, increase lacrimal secretion, increase secretion from all glands of human body, increase migration of eosinophil and neutrophil at the site of the local injury. So these are the effects caused by the chemotactic agents or chemokines which are secreted from the granules of the mast cell. So you can see this is the mast cell. You can see it is causing edema, it is causing vascular congestion, it is causing vasodilatation, it is attracting the eosinophil at the site of the injury. So these are the effects. Same is shown in this diagram also. So in this diagram, we can see this is a mast cell. We can see these are the IgE antibodies attached on the mast cell by Fc fragment. We can see when the antigen is coming second time, same antigen coming second time or subsequent time, the antigen is binding on the Fab fragment of the antibodies which are already attached on the surface of the mast cell. So when antigen binds with the IgE antibody gets stimulated and it gives signal to the mast cell. Mast cell will get stimulated and it will release the granules out. It will burst and release the granules out. This is known as degranulation. Now the granules contain all the various chemotactic substances, as I have told you, prostaglandins, leukotrienes, membrane phosphatase and multiple substances, and these all will cause the various responses in human body leading to allergy. So type 1 hypersensitivity is of two types, that is allergies are of two types. If the allergy is systemic, that is in complete body, it is fatal, it is very fatal, potentially fatal, it is known as anaphylaxis. And if it is localized, it is known as atopy. So systemic one is known as anaphylaxis and localized one is known as atopy. So let me discuss the two in detail. Anaphylaxis, as I have told you, anaphylaxis is the systemic type 1 hypersensitivity reaction. It may be fatal sometimes. So it occurs within few seconds to few minutes following the second time exposure, that is shocking dose of the antigen. Cytotropic IgE antibodies are responsible for this type of anaphylaxis. The tissues or organs affected in the anaphylaxis are known as target organs, and most commonly involved organ is the lung. In the lung, bronchospasm will occur and patient have respiratory problems, sudden respiratory distress due to bronchospasm, laryngeal edema, patient have respiratory distress, sometimes shock and death. It is not related to heredity. Now coming on the second type, that is atopy. Atopy is the localized form of the allergy or localized form of type 1 hypersensitivity. Here the examples are hay fever and asthma. Here antigens can be pollen grain, can be house dust, can be certain foods. Here atopins, that is allergens induced IgE antibody, formerly known as Reagan. It is predisposition to atopy is genetically determined and it is linked to MHC genotype. Atopy runs in the family, so it is hereditary, you can say. So reaction can occur at the site of the entry. Just for suppose if inhalation of the pollen grain is there, it can result in bronchial asthma. If ingestion of the fish, milk, egg or drugs is occurring, then the patient have GIT symptoms and cutaneous eruptions. If contact lens is leading to the local allergy, it will lead to conjunctivitis. So allergy occurs at the site of entry of the pollen. So that's why it is localized. It is not systemic, it is not generalized. That's why it is known as atopy. So these are the two types of type 1 hypersensitivity reaction, type 1, localized one and generalized one. If it is localized, it is atopy. If it is generalized and systemic, it is anaphylaxis. Now, what are the examples of type 1 hypersensitivity? Type 1 hypersensitivity includes all allergies. Example, it includes eczema, hay fever, asthma. These all are the types of atopy because they are localized. And urticaria, anaphylactic shock is systemic, that is generalized. Acute dermatitis, Theobald-Smith phenomenon, Prutzner-Kutzner reaction, that is known as PK reaction, Cassoni skin test, and Schultz-Dale phenomenon. So these all are examples of type 1 hypersensitivity. To simplify this, we will be learning a mnemonic to learn the examples of type 1 hypersensitivity. Now in type 1 hypersensitivity, we know all allergies are there. Apart from all allergies, all allergies may include asthma, hay fever, atopic, anaphylaxis, urticaria, contact dermatitis. These are the various types of allergies. Apart from allergies, there are 3 named reactions that you must learn in the examples of type 1 hypersensitivity. The 3 named reactions can be learned with the help of a mnemonic known as PCT. PCT. P stands for Prutzner-Kutzner reaction, PK reaction. C stands for Cassoni test and T stands for Theobald-Smith phenomenon. Now, let me give you the detail of Schultz-Dale phenomenon. What is this Schultz-Dale phenomenon? Schultz-Dale phenomenon is anaphylaxis in vitro. Anaphylaxis is severe form or systemic form of type 1 hypersensitivity. When we carry out anaphylaxis in vitro, that is outside the living body, outside the human body, in vitro, then it is known as Schultz-Dallé phenomenon. How it is done? So for the experiment, we will take guinea pig. We will sensitize the guinea pig. That is, the first exposure is already done. So first exposure of the antigen is already done. So inside the body of the guinea pig, that first exposure of the antigen is already captured by dendritic cell. The dendritic cell processes the antigen, present it to Th2 cell. Th2 cell secretes certain chemokines that will stimulate B lymphocytes. B lymphocyte convert into plasma cell, forming Ig antibody, and that Ig antibody is present on the surface of the mast cell. This event is already occurred inside this guinea pig because guinea pig is sensitized. Now, we will isolate certain organs from the guinea pig, that is uterus, ileum, intestine, and take all the organs out of the body of the guinea pig and take them in a tray in a ringer bath solution. Take them in a tray in a bath of ringer solution. So after that, we are giving the second dose, that is specific antigen second time. We are exposing it outside the body. So we are adding the second dose, that is shocking dose, in that ringer bath solution in the tray where these organs are present. So the first dose exposure is inside the body of the guinea pig, but the second dose exposure in a sensitized guinea pig is outside the body in the organs. So as soon as we add the second dose, that is shocking dose, in the ringer bath solution in the tray, we will see the organs contract vigorously. So we can see this is anaphylaxis in vitro. We can notice it in vitro, and this is known as Schultz-Dallé phenomenon. So Schultz-Dallé phenomenon is anaphylaxis in vitro. It is an experiment done on the guinea pig where the sensitized guinea pig are already taken, the organs are isolated, and in the isolated organs, the shocking dose is introduced outside the body. So that is Schultz-Dallé phenomenon. Now we are done with type 1 hypersensitivity reaction in detail, its pathogenesis, mechanism, and examples. Let's start type 2. Type 2 hypersensitivity reaction. Type 2 hypersensitivity reaction, also known as antibody mediated reaction, also known as cytotoxic reaction. It is mediated by the antibodies which are directed towards the antigen which are present on the surface of the cell. So in contrast to type 1, here in type 2, there is a difference in the antigen. In type 1, the antigen can be a dust particle, can be a pollen grain, can be a food particle. But in type 2, the antigen is not a free antigen. The antigen is present on the surface of a target cell. So this is the antigen. The antigen is not free antigen. It is present on the surface of a cell, target cell. That is the difference in antigen in type 1 and type 2. So that is type 2. So here we can see the complete mechanism. We will be discussing all the steps in detail one by one. So let's start the details of the step. So as soon as the antigen which is present on the surface of the target cell, that is exposed, now directly B lymphocytes will get activated. In contrast to type 1, where antigen was free and first it was going to the dendritic cell, then dendritic cell was stimulating the Th2 cell, then Th2 cell was secreting the B cell. Here the antigen is present on the surface of the target cell directly and directly stimulating the B lymphocyte. On stimulating B lymphocyte, as usual, convert into plasma cell, and plasma cell will form antibodies. But this time antibodies which are formed are IgG or IgM. It's not IgE. In contrast to type 1 hypersensitivity, where plasma cells were forming IgE antibody. So IgE antibody are specific for type 1 hypersensitivity. But in type 2 and type 3, IgG and IgM will be formed. So here IgG especially and sometimes IgM will be formed. You can appreciate the same in the diagram also. In this diagram, you can see these are the target cells, small cells are shown here, and on the surface of the target cell antigen is present. So the antigen which is already present on the surface of the target cell, it is stimulating the B lymphocytes. On stimulating, B lymphocytes convert into plasma cell and start forming antibodies. These antibodies are IgG or IgM. Now, antigen will combine with the antibody and antigen-antibody complexes are formed. So antigen which is present on the surface of the target cell, it will bind with the antibody, FAB portion of the antibody which is IgG or IgM, and antigen-antibody complexes are formed in the circulation. In the circulation, these antigen-antibody complexes which are present in the circulation, they will stimulate the complement. They will fix the complement. The most important complement activation, here classical pathway activated of the complement system. The most important complement which get activated here is C3b. C3b acts as a opsonin. C3b acts as a opsonin that will attract the phagocyte. You can appreciate this is antigen-antibody complexes formed. They will activate the complement. Here the complement activation takes place via classical pathway, and the most important complement which is activated is C3b, and antigen-antibody complexes along with complement formation will take place. Now the activated C3b will bind to the target cell as a opsonin and it will attract the phagocytes for the cell destruction. Now the phagocyte will come and causes the phagocytosis. This is how host destruction, host injury take place. So you can see in the end, this is the phagocyte which is coming, which is causing the phagocytosis of the target cell along with antigen, along with antibody and along with the complement. So let me show you same in this diagram also. You can see this is the target cell. Can you appreciate this is the target cell? On the surface of the target cell, you can see this is the antigen present. So antigen is present on the surface of a cell. It is not a free antigen. It is stimulating B lymphocyte. B lymphocyte are forming the antibodies. You can see the antibodies are directly bind on the surface of the antigen. You can see antigen antibody complexes are formed. Now this antigen antibody complexes are stimulating the complement. The most important complement here is C3b. You can appreciate. This is C3b. Complement fixation takes place. C3b will form and it will stimulate the phagocyte. Phagocyte will come and engulf everything. So this is the engulfment or phagocytosis done by the phagocyte. So I will draw the same for you. You can see this is the target cell. On the surface of the target cell, you can see this is the antigen, right? Now this is stimulating the B lymphocytes. This is stimulating the B lymphocyte directly. B lymphocyte will get converted into plasma cells. On converting into plasma cell, it will start forming antibodies. But these antibodies are IgG or IgM. These are not IgE. These antibodies will react on the surface of the target cell with the antigen which is present on the surface of the target cell. So these antibodies will come here and they will react like this. Now antigen antibody complexes are formed. These antigen antibody complexes will fix the complement. The complement will get stimulated. The complement will get stimulated here. So the complement here, you can say the complement will come and that complement will bind here. The complement is C3b. C3b and it is acting like a opsonin. Opsonin means tagging of the foreign material. Now, since this is acting as a opsonin, the next cell which will come is the phagocyte. This is a phagocyte. This because it is attracting the phagocyte. The C3b opsonin attracting the phagocyte. Phagocyte will engulf complete thing. It will engulf the antigen, antibody, complement, everything along with the target cell which is a human cell, which is a host cell. This is how it is causing host cell injury. And this is the mechanism of type 2 hypersensitivity. Now, what are the examples of type 2 hypersensitivity? There is a mnemonic for that. The mnemonic is my blood group is Rh positive. So M for my stands for myasthenia gravis. Blood stands for blood transfusion reaction. Group ka G stands for good pasture syndrome as well as Graves disease. I of is stands for insulin resistant diabetes and ITP, that is immune thrombocytopenic purpura. R stands for rheumatic fever. H stands for hyperacute graft rejection and P of positive stands for pernicious anemia and pemphigus vulgaris. So these are the examples of type 2 hypersensitivity reaction. You can learn with the help of a mnemonic. My blood group is Rh positive. Now coming on type 5. Type 5 hypersensitivity reaction, which is a special type of type 2. So type 5 is the stimulatory type of the reaction, which is a special type, which is a modification of type 2 hypersensitivity reaction. Here also antibodies are formed against the antigen which are present on the surface of target cell and antigen antibody complexes will be formed. So when antibody formed with the antigen, instead of inhibiting it, instead of killing the cell, here the antibodies are stimulating or proliferating or differentiating the target cell. So that is the only difference. So the examples here are myasthenia gravis and Graves disease. You can see here in Graves disease, this is a thyroid cell. On the surface of the thyroid cell, TSH receptor is present. So antibodies are formed against the TSH receptor. You can see these are the antibodies against the antigen which is present on the surface of a target cell. So when antibodies come and bind with its antigen, that is TSH receptor, instead of killing this cell, it is causing stimulation of the cell in the same way as TSH is binding. So it will cause secretion of the thyroid hormone which leads to hyperthyroidism. So this is the example. It is Graves disease. In the Graves disease, you can see when antibody is coming, binding with the antigen, on binding, it is causing stimulation of the antigen. Instead of destroying the cell, it is causing stimulatory effect. So that is the difference between type 2 and type 5. In type 2, when antibodies are coming and binding with the antigen present on the cell, it is causing degradation of the cell, destruction or killing of the cell. But in type 5, when antibodies are coming, binding with the antigen present on the surface of the target cell, they are causing stimulation of the cell. So type 2 is inhibitory type and type 5 is stimulatory type, but the mechanism for both of them is same. So in type 5, the example is Graves disease, one of the examples that I have explained you. The second example is myasthenia gravis. In myasthenia gravis, you can see this is the muscle, skeletal muscle. On the surface of the skeletal muscle, muscarinic receptors are present for acetylcholine. Now in myasthenia gravis, the antibodies are formed against the muscarinic receptors. You can see these are the antibodies which are formed against the M receptors, muscarinic receptors present on the surface of the skeletal muscle. Now, when these antibodies are coming and binding with the antigen which is already present on the cell of the skeletal muscle, it is causing stimulation of them. So when the muscarinic receptors are stimulated in the same way as normal acetylcholine causes their stimulation, it causes contraction of the muscle. So that is myasthenia gravis. So see the example of the myasthenia gravis as well as Graves' disease. In both of them, type 5 hypersensitivity reaction holds good. So these are the example of type 5. So we are done with type 1 hypersensitivity reaction, its pathogenesis, its example. We are done with type 2 hypersensitivity reaction, its pathogenesis, example. A special type of type 2, that is type 5, is also completed, that is stimulatory variant of type 2. Now I'm coming on type 3. The type 3 hypersensitivity reaction. Type 3 hypersensitivity reaction, also known as immune complex mediated reaction, Arthur's reaction. Here also antigen antibody complexes will be formed, but the antigen antibody complexes will be deposited on the tissue from the circulation and then causing inflammatory reaction in the tissue and leading to the destruction of the tissue cells. So here the complete mechanism is shown in this flow chart. In this diagram, I will be explaining all the steps in detail. Let me start the pathogenesis of type 3 hypersensitivity. So here the antigen is soluble antigen. Now appreciate the difference between the antigen. In type 1 hypersensitivity, the antigen is a free antigen like a pollen grain, like a dust particle. It is a particulate, solid, free antigen. In type 2, the antigen is present on the surface of a target cell. It is not a free antigen. It is already present on the surface of target cell. The target cell is a host cell. In type 3, which I am teaching right now, in type 3, the antigen is a soluble antigen. So when this soluble antigen enters human body, it directly stimulates B lymphocyte. The B lymphocyte converted into plasma cell, and as usual, plasma cells start forming antibody. Again, this time antibodies are formed as IgG and IgM, not Ig. It is like type 2 hypersensitivity only, IgG and IgM are formed. Now, in this diagram also, you can see this is soluble antigen. When the soluble antigen enters human body, you can see it is stimulating B lymphocyte converted into plasma cell, and these are the antibodies are formed. And then antigen antibody complexes will be formed. So antigen antibody complexes, the immune complexes which are formed first in circulation, they will be deposited in the tissue. After depositing in the tissue, they will fix the complement, they will activate the complement. So they will fix the complement, they will activate the complement C3A and C5A. So here C3A and C5A will get activated. You can see here antigen antibody complexes are formed. They are going and depositing over the tissue and they are activating the complement. Now C3A stimulate the histamine from the mast cell, which results in increased vascularity and edema of that particular organ in which the antigen antibody complexes are present, and C5A release the pro-inflammatory mediators that will attract the neutrophils and macrophages and causes inflammation and tissue destruction of that particular tissue where antigen antibody complexes are deposited. So I would show you here. You can see this is the tissue. This one is the tissue. On the tissue, these antigen antibody complexes are deposited and attracting the complement, fixing the complement. So you can see due to the complement fixation, the neutrophils are coming and causing the inflammation of the tissue, which is causing tissue destruction here. That is the mechanism of type 3, which can be shown here also in this diagram also. In this diagram also, in the blood, you can see these dots are the antigen. In the blood, this is antigen present in the circulation. So it is the antigen present in the circulation. It is stimulating the B lymphocyte. B lymphocyte converted into plasma cell. The plasma cell is forming antibodies. So appreciate the antibodies. So antigen antibody complexes are formed. You can appreciate antigen antibody complexes are formed in the circulation. After forming in the circulation, the antigen antibody complexes are deposited over the tissue. Can you appreciate here? They are deposited over the tissue. Once they got deposited over the tissue, they are stimulating the complement and the complement fixation takes place. The complement attracts the neutrophil, that is inflammation, and inflammation leads to tissue destruction. So this is the complete story. Let me draw the same diagram for you. This is a soluble antigen. This antigen is soluble antigen. When it enters human body, it directly stimulates B lymphocyte. B lymphocyte convert into plasma cell. Plasma cells start forming antibodies. So antibodies which are formed, they are IgG or IgM. Now antigen antibody complexes will be formed. So antigen, this is antibody, and this is antigen. You can appreciate this is antigen antibody complexes are formed. These antigen antibody complexes will be deposited on the tissue. This is tissue. So on the tissue they will be deposited and they will fix the complement. So here complement will come, complement will be fixed, and antigen antibody complexes along with this complement, they attract the neutrophils and they will attract the inflammation, and inflammation causes leading to the destruction of the tissue. So that is type 3 hypersensitivity mechanism. It is also of two type. Like type 1, it is also of two type. If it is localized, it is known as arthrus reaction. If it is generalized, it is known as serum sickness. So it is of two type. Now what are the examples of type 3? There are few examples which can be learned with the help of a mnemonic. The mnemonic here is SHARP, sharp. So S stands for serum sickness, Sheik test and SLE. It is triple S. Three examples are there from S. Serum sickness, Sheik test and SLE. H stands for HS purpura. A stands for arthrus reaction. R stands for reactive arthritis and Raji assay. And P again stands for two things. It is polyarthritis nodosa and PSGN, post-streptococcal glomerulonephritis. These are the examples of type 3. So we are done with type 1, 2, 3. Let's start the last type of hypersensitivity, that is type 4. Type 4 hypersensitivity is known as delayed or cell-mediated type of hypersensitivity. So type 4 is the delayed hypersensitivity, also known as T-cell mediated reaction. Here, tissue injury is by cell, T-cell mediated immune response. Here, B lymphocyte will not come in role. T lymphocyte will come in role, and it is an example of delayed type of hypersensitivity. The first three were the example of immediate type. The first three were the example of immediate type of hypersensitivity, but this one is an example of delayed type. The first three were example of antibody mediated. That's why B cell have a role. B cell converts into plasma cell and it forms antibody. But this type B cell don't have a role. It is cell mediated. That's why T lymphocytes have a role. Here reaction occurs after 24 hours of the exposure of the antigen, and it is prolonged. Up to 14 days the reaction will take place. That's why it is delayed. So the complete mechanism, the pathogenesis is shown in this diagram. We will be discussing the complete pathogenesis step by step in detail. So let me start the steps in this diagram. So the first step, as soon as the antigen will come, it is captured by CD8 T cells, that is cytotoxic T cell, and they are processed by the antigen presenting cell. You can see this is the antigen. Here the antigen is non-degradable antigen. As soon as it is coming, so it is going to CD8 T cell. So this is a CD8 T cell which is processed by the antigen presenting cell. So antigen presenting cell is migrating to the lymph node where antigen is presented to the helper cells. So this antigen presenting cell taking the antigen, degrading it, processing it and present it on the surface and migrating it to the lymph node. In the lymph node, it is exposed to CD4 T cells. So in the lymph node, first helper T cells will secrete certain cytokines and it will stimulate CD4 T cells. Now the CD4 T cells are the main cell. They will secrete certain cytokines. The most important cytokines here are interferon gamma, TNF alpha and interleukin 2 and interleukin 12. That will result in granuloma formation. The granuloma formation is typical in this type of hypersensitivity and that is the end result here. So let me draw the complete diagram. You can see here the granuloma is formed. So here ultimately granuloma is formed because of which. So let me draw the antigen. So this antigen is non-degradable antigen. As soon as antigen enters the human body, the first cell which get activated is CD4 T cells. The CD4 T cells present it to the antigen presenting cell. Antigen presenting cell will take the antigen, try to degrade it, but antigen is poorly degradable. So present this antigen on the surface and migrate it to the lymph node. In the lymph node, it will present it to CD4 T cell. This one was CD8, the first one, and next is CD4 T cell. Now this CD4 T cell will secrete 3 cytokines. You can appreciate the name of the 3 cytokines. The first one is interferon gamma. The second one is TNF alpha. And the third one is interleukin 2 and interleukin 12, 1, 2, 12. So what these 3 cytokines are doing? They will attract one cell and ultimately results in the formation of granuloma. So the interferon gamma, it will convert the monocyte. The monocyte will leave the blood and it will come in the tissue, and once the monocyte leave the blood and come in the tissue, it is known as macrophage. So first monocyte get converted to macrophage and then macrophage is modified. Macrophage is modified, the cytoplasm become abundant, the nucleus becomes slipper shaped. It is known as modified macrophage, and modified macrophage is known as epithelioid cells. Epithelioid cells. These epithelioid cells are formed by interferon gamma. So interferon gamma first causing the mobilization of monocyte leaving the blood and coming in the tissue. So first monocyte get converted to macrophage and then macrophage become modified, and it is known as epithelioid cells, which are the main cells in granuloma. Now multiple macrophage, multiple epithelioid cells join together So here is one nucleus, one nucleus, one nucleus. When multiple epithelioid cells join together, it is forming giant cells. So giant cells are formed by the fusion of epithelioid cells. So you can see the complete sequence. In the complete sequence, first monocytes are present in the blood, which is a type of WBC. Monocytes leave the blood and they will come in the tissue. In the tissue, they are known as macrophage. Now, monocyte are no more monocyte, they are known as macrophage. Macrophage will be modified. The cytoplasm become abundant, vacuolated, pale, nucleus become vesicular. It is known as modified macrophage. The modified macrophage is known as epithelioid cell. Now, multiple modified macrophage or epithelioid cell fuse with each other and they lead to giant cell formation. So, this is interferon gamma. Interferon gamma is leading to the formation of epithelioid cell and giant cell. This is how interferon gamma have a role here. Now, coming on the second one is the TNF alpha. TNF alpha attract more and more fibroblasts. These are the fibroblasts. And the next are interleukin 2 and interleukin 12. So they will attract more and more lymphocytes, more and more T lymphocytes, causing proliferation of T lymphocytes. So total 3 cells are there. Epithelioid cells, which are formed by interferon gamma. TNF alpha forming fibroblasts and interleukins are forming T lymphocytes. They will rearrange themselves and they will form granuloma. So this is how ultimately granuloma is formed. See, appreciate in this diagram, you can appreciate this is the antigen. So antigen is first captured by antigen presenting cell. So you can see this is the antigen inside the antigen presenting cell. It is migrating to the lymph node and presenting it to CD4 T lymphocyte. The CD4 T lymphocyte secrete 3 cytokines. The first one is interferon gamma, the second is TNF alpha, and third is interleukins. You can see the role of each of them. You can appreciate the interferon gamma, first monocyte leave the blood and coming, it is known as macrophage. And macrophage become modified and form epithelioid cells. The epithelioid cells will form the center of the granuloma. The second TNF alpha, they will cause proliferation of fibroblasts. And the interleukins, they will cause proliferation of lymphocytes. So ultimately in the granuloma, 3 types of cells are present. In the center, epithelioid cells are present. You can see these are the epithelioid cells in the center. Few epithelioid cells fuse with each other and they result in the formation of the giant cell. So these 2 things are due to interferon gamma. You can appreciate it is surrounded by lymphocytes. These are the lymphocytes. The lymphocytes are coming here by interleukins, and outermost, at the most periphery, outermost are the fibroblasts. Fibroblast proliferation takes place by TNF alpha, and this is the ultimate diagram of a granuloma. So the end result here is a granuloma. You can appreciate the same granulomas here also. So this is type 4 hypersensitivity, where the end result is a granuloma because of 3 cytokines. Interferon gamma, which leads to formation of epithelioid cells and giant cells. TNF alpha, which leads to proliferation of fibroblast, and the third one is the interleukins, interleukin 1, 2, 12, which leads to proliferation of T lymphocyte. The 3 cells rearrange themselves in the form of a nodular thing that is known as granuloma. Now coming on the examples of type 4. The examples of type 4 are, there is a mnemonic for that. The mnemonic is John gave tulip popcorn to Hershey. So John stands for John motor reaction. Tulip, T stands for tuberculin, and L stands for lepramin reaction. So tuberculin reaction, lepramin reaction. Popcorn, P stands for pernicious anemia, C stands for contact dermatitis, and Hershey stands for Hashimoto thyroiditis. So these are the examples of type 4. So we have learned all 4 types of hypersensitivity. We have learned that type 1, 2, 3 are the example of antibody mediated hypersensitivity, and type 4 is the example of cell mediated hypersensitivity. So what is the summary of this session? What we have learned in this session? In this session, we have learned everything about hypersensitivity. What is hypersensitivity? Hypersensitivity is the exaggerated immune response. So when the immune response becomes exaggerated, it destroys host tissue. It causes injury to the host tissue. It is harmful for the host tissue, and that is known as hypersensitivity. We have learned the hypersensitivity is of 4 types. What are the 4 types of hypersensitivity? Type 1, 2, 3, 4. Out of the 4 types, the first 3 types are immediate type and the last one is the delayed. The first 3 types are antibody mediated, but the last one is the cell mediated. Type 1 is known as anaphylactic or atopic. If it is systemic, it is known as anaphylactic. If it is generalized, it is known as anaphylactic. If it is localized, it is known as atopic. Type 2 is known as antibody mediated or cytotoxic. Type 3 is known as immune complex mediated, and type 4 is delayed or T cell mediated. In type 1, rapidly developing immune responses there in a previously sensitized individual. That is the mechanism in short, and main antibodies here are IgE antibodies. In type 2, there is reaction of humoral antibodies that attack the cell surface antigen and causes cell lysis. That is, here the antigen is present on the surface of the target cell. In type 3, antigen-antibody complexes are formed, and these complexes will deposit it on the tissue. Here the antigen is a soluble antigen, and that deposition of antigen-antibody complexes will lead to inflammation of that particular tissue, leading to tissue destruction. And in type 4, it is cell-mediated type, which is slow and prolonged. As I've told you, the first three types are immediate type. Here in type 1, the peak action is after 15 to 30 minutes of exposure. In type 2 also, the peak reaction is 15 to 30 minutes of exposure. In type 3, it is within 6 hours of exposure. And in type 4, it is after 24 hours of exposure. That's why type 4 is delayed type. The first three types are immediate types. In type 1, 2, 3, all of them antibodies are formed. That's why first three types are antibody mediated. In type 1, IgE antibody is formed. In type 2, IgG or IgM is formed. In type 3, IgG or IgM is formed. But in type 4, no antibody is formed. It is cell mediated, T cell mediated, which will secrete 3 cytokines and leads to formation of granuloma. So we have seen the etiology of the 4 types of immunity hypersensitivity is in front of you. In type 1, it is the genetic basis, pollutants or viral antigens. In type 2, it is HLA linked and exposure to the foreign tissue or cells. In type 3, it is persistence of low-grade infection, environmental antigen or autoimmune process. And in type 4, it is CD8 T lymphocyte cutaneous antigens are there. That is the etiology. Now coming on the examples of the 4 types. I have given you 4 mnemonics to learn the 4 examples of 4 types of hypersensitivity. Type 1, the example is PCT. P stands for Putzner-Kutzner reaction, C stands for Cassoni test, and T stands for Theobald-Smith phenomenon. So apart from all allergies, the examples are PCT in type 1. Coming on type 2, these were the examples of type 1. Coming on type 2, the examples of type 2 are in front of you. The mnemonic is my blood group is Rh positive. So M stands for myasthenia gravis, B stands for blood transfusion reaction, group G of group stands for Goodpasture syndrome and Graves' disease. I of is stands for insulin resistant diabetes and immune thrombocytopenic purpura ITP. R stands for rheumatic fever. S stands for hyperacute graft rejection, and P of positive stands for pernicious anemia and pemphigus vulgaris. These all are examples of type 2 hypersensitivity. Now coming on examples of type 3 hypersensitivity, the mnemonic is SHARP, sharp. The mnemonic is sharp. So S stands for serum sickness and Sheik test and SLE. It is triple S. H stands for HS purpura. A stands for arthrus reaction. R stands for reactive arthritis and Raji assay. And P stands for PAN and PAN, that is polyarthritis nodosa, and post-streptococcal glomerulonephritis, that is PSGN. So SHARP, that is the mnemonic to learn the examples of type 3 hypersensitivity. And the last one is the type 4 hypersensitivity. The mnemonic is in front of you. The mnemonic is John gave tulip and popcorn to Hershey. So John stands for John Motte reaction. Tu stands for tuberculin reaction. Lip, L of lip stands for Lepramin reaction. Pop, P of pop stands for pernicious anemia. Corn, C of corn stands for contact dermatitis. And Hershey stands for Hashimoto thyroiditis. So these are the examples of type 4 hypersensitivity. So we have learned the definition of hypersensitivity, the classification of hypersensitivity, the 4 types of hypersensitivity, their pathogenesis in detail and their examples in detail along with their mnemonics. So that's all about hypersensitivity.